There are certain rules and precautions that the expectant mother has to follow to make sure the transfer comes positive. Some of the queries which my patients have asked me in this past 20 years, I would like to share here. The first and foremost doubt they have is that following the embryo transfer that they have to be bed rest. Now that's really wrong, because we have seen that complete bed rest increases the stress level, because most of the time you're sitting and thinking about how it's going to come, but considering the mindset, we would rather think that it would come negative, so how would I deal? So this increases the stress. So we encourage our patients or the expectant mother to engage in small day-to-day activities. We would not ask them to do long distance travel or walk for a longer distance, but they can do their normal household works like walking in the house or folding the clothes and taking part in cooking. Another frequently asked question is, can we travel or can we have sexual intercourse? Traveling, if it is unavoidable, can be undertaken. Not necessary that it should be really avoided, but there are certain precautions which needs to be taken. Is that the travel should be smooth, avoid bumpy rides, avoid very long distance travel, drink water frequently, and make sure that you pass urine frequently also. Intercourse, we advise them to avoid, considering it can be very strenuous, can lead to infection, so intercourse needs to be avoided. We need to also avoid going to the crowded places, as we have already know that crowded places it can catch infections, and considering it's a COVID pandemic which is going on, we would even advise them not to go into crowds or go for any shopping. As it's a treatment process, most of the time our expectant mothers are put on multiple medicines and injections which they have to take on a frequent intervals and frequencies. They may miss one or two medicines and injection, not to be really stressed about it, because most of them are supportive medicines, not really the essential medicines. So they have to be sure that they take it regularly, but not to be very tensed about missing one or two medicines or injections. Expectant mother can continue to do their yoga and exercises also. Here in IKEA, we encourage them to be in constant touch with their yoga therapists and counselors, so that they get a positive reinforcement from them. As I've already told, that regular exercises or small walks and talks can go in a long way to reduce the stress levels.